The next disease is ASCARIASIS. Last time we have to discuss about the amoebiasis. Now see the disease ASCARIASIS. ASCARIASIS, this is an intestinal tract infection in the human being. It affects to the human gastrointestinal tract. Causative agent is Ascaris lumbricoides, most commonly called as a roundworm. See the sign and symptoms here. Here gastrointestinal discomfort. This is the disease, is the infection of intestinal tract intestinal tract. So the gastrointestinal discomfort occurs here, accompanied with the fever and vomiting also. Here live worms are found in the fecal matter of infected person. Pulmonary disorder in severe patient, you have to observe the pulmonary disorder and pneumonitis. Here the alveolar wall is affected. Loss of appetite and weight loss, these are some symptoms. And eosinophilia, increase the number of eosinophil in the blood is a eosinophilia. So these are some signs and symptoms of the disease Ascariasis. See how this disease get transmitted from one person to another person. Here mode of transmission, mostly the main cause of mode of transmission of this disease is a contaminated food and drink. If food and drink is contaminated with the eggs of Ascaris, then this is spread into the person. Healthy person may be infected. Here when eggs enter in the human intestinal tract with the help of food, contaminated food or drink, these are hatched in the intestine and release the larvae inside the intestine. This disease we have to observe or we have to recognize diagnosis by microscopic examination of the stool sample. We have to take the stool sample of the infected person and then we observe under the microscope, and microscopic examination reveals that disease. We have to diagnose this disease. Then how we have to treat? Here some anti-helminthic drugs we have to use here, like the piperagine, mebendazole, levamisole and pyrantel. These are some anti-helminthic disease which we have to use to treat the disease Ascariasis. Then prevention and control, how we should prevent this disease and control this disease. So avoiding defecation in open space to prevent this disease. Actually infected person when perform the defecation in the open space and such fecal matter come in contact with the drinking water sources or vegetables, raw vegetables or whatever. So the eggs of this Ascaris enter in the food material and in the intestinal tract. So avoiding defecation in the open space. Then personal hygiene, wash the hand thoroughly with the help of warm water and the soap before taking the milk or after using the toilet, and washing the vegetables thoroughly and cook thoroughly. Cook the vegetables, washing the vegetables thoroughly and cook thoroughly. These are some preventive and control measures of the Ascariasis disease. Next disease is the filariasis. It is also called as the elephantiasis disease. See here the causative organism of this disease is a thread-like worms nematode. Here there are three types of the filariasis on the basis of affecting areas, like the lymphatic filariasis, subcutaneous filariasis and serous cavity filariasis. It is also called as abdominal filariasis. There are these three types of filariasis are there. Here lymphatic filariasis is the most common and it is caused by some agents, some worms like the Eukarya bancrofti, Brugia malayi and Brugia timori. These are the worms which cause the lymphatic filariasis. Here sign and symptoms is oedema. Oedema is a swelling of skin and underlying tissues. Eukarya bancrofti in lymphatic filariasis. It causes the lymphatic filariasis. So in the lymphatic filariasis, Eukarya bancrofti affects the legs, arms, breast and scrotum, etc. So in this disease, in the lymphatic filariasis, this worm, that is Eukarya bancrofti and Brugia malayi or Brugia timori, it infects to the lymphatic system, lymphatic vessels, and due to infection of lymphatic nodes, lymphatic vessels, swelling occurs there. Swelling in the legs, arms occurs there, and this condition is called as elephantiasis. The legs are very broader swells like the elephant, foot of the elephant, hence it is called as elephantiasis disease. Lymphedema is a swelling of lymphatic system, lymphatic vessels, and it occurs due to the accumulation of lymph in the tissues. So it results into the swelling. Then hydrocele, here the enlargement of testis is a hydrocele, and here the lymph accumulated inside the testis. So testis becomes enlarged. This condition is called as a hydrocele. How this disease transfer? This is the mode of transmission. Here this disease is transmitted by the vector. This vector is a Culex mosquito. Here the larvae escape from the mosquito body and arrive on the human skin. Then that larvae penetrate the human skin, penetrate to the skin of the human and undergo two moltings. Two moltings occur, two times their form change here and it becomes an adult. Then this adult worms settle in lymphatic system of the human being, and then it causes the swelling in the lymphatic vessels, lymphatic system. Incubation period 8 to 16 months. It infects the human being, and to show the symptoms, this duration is called as incubation period, and here the incubation period is 8 to 16 months. Treatment, how this disease we have to treat? So here some drugs we have to use like the diethyl carbamazine citrate twice a day for 3 weeks, and after that for 5 days every 6 months. Same disease we have to give here. Prevention and control. So actually this is transfer or transmitted by the vector Culex mosquito. So we should avoid the mosquito bite by using the mosquito repellents or net, etc. Mosquito net, mosquito repellents we have to use here. And we should perform the eradication of mosquito because it is a vector-borne, mosquito-borne disease infected by the mosquito. So eradication of mosquito must be occurs here. These are some preventive measures and control measures of the disease filariasis or the elephantiasis. Okay.